Some Mpilo student nurses have raised alarm demanding better working conditions, stating that they were not immune to the coronavirus following the quarantining of other students at Ilangeni Quarantine Center due to the deadly virus. A contribution made during the Amakhosikazi chat room, where the director of Mpilo, Dr. Solwayo Ngonya, was the guest speaker, highlighted that since the beginning of the nationwide lockdown, Mpilo student nurses have been forced to work without the help of senior nurses and without proper personal protective equipment.
Right now, the nurses have been on strike for, I think, if it's not a month and some weeks, it's now for the past 2 months. They're trying to have their needs be heard. They're trying to verbalize that no, the amount of money they're getting is not enough. But mostly because we are in a time of facing the pandemic of corona, they are mostly advocating for protective clothing. But may we try and take a look and see who has been feeling their absence in the hospitals. The student nurses are feeling their they are feeling their absence in hospitals. Right now as we speak, most of Mpilo's wards, especially casualty, is being handled by students. And if lucky on the day, our newly appointed qualified staff, apart from that, students are running that hospital. Of course, with the help of the sisters in charge and matrons. But those people work in their offices, they force those children to go into the wards to work without protective clothing. I remember that there was once an incident a few months back where the children were trying to verbalize that no, you can't force us to work in a ward where there are no protective clothing. And those children were not taken serious.
However, in his response, Dr. Solwayo Ngonya dismissed the lady's contribution to the chat room, stating that COVID-19 is an infectious disease. Once a person becomes positive, they fall under the remit of the Bulawayo City Health Department. Amakhosikazi media caught up with some of the students from Mpilo Central Hospital in Bulawayo, who confirmed that their working conditions are exposing them more to coronavirus.
As you are aware that 3 months back, student nurses of Mpilo Hospital took a stand trying to hear the needs of consent be heard. This was because there were nurses that were on strike because of lack of protective clothing. Uh, what made the students the most, what made the students at most to be forced to take a stand, it was because the doctors wouldn't come to the wards, and if they came, they would tell the students that if you're not a qualified nurse and there's no protective clothing, then we are not coming to attend whatever case you you have called us for. The students took a stand. They were being forced to work in the wards with no protective clothing. The sisters in charge would force them. At times, what was so sad that even the matrons would go there and tell them, "Ngironima wadin. This is what you came to do. This is a learning phase for you guys, and this is part of a learning phase." Well, a bit of protective clothing was donated, but still it wasn't enough. We all are aware that there have been cases at Mpilo hospitals of nurses and doctors and even patients testing positive for COVID, which has led to even the nurses going on a strike again, of which it is still an ongoing strike. The cases of corona have increased and keep on increasing day by day. And I think not few weeks back, we were reading in newspapers about a nurse that tested positive for COVID and 3 other patients. Don't you think we should also put the needs of those students at heart? Because, mind you, we are training them to be future nurses of tomorrow. But at the same time, it does not mean that because we are training them to be our nurses of tomorrow, it doesn't mean we should put them through a traumatic situation.
As COVID-19 cases increase, so is the fear of the students who are being forced to work in an environment where the spread of COVID-19 is inevitable. As a result, Mpilo student nurses are demanding for better working conditions and the presence of senior nurses in the wards, stating that their purpose was to learn and become qualified health workers, not to die of COVID-19 before wearing their graduation gowns. Marvelous Matswimbo reporting for Amakhosikazi Media in Bulawayo.